Okay, chapter 11 is about pulling it all together. This is the expectations about your job role again. You've already gotten a job description. You make sure you know what is expected for what you can do, what you've been trained to do, what you've been checked off to do. But then pulling it all together with time management and getting your job completed. So nursing assistants provide about 80% of the care for your residents in long-term care facilities and healthcare facilities. You have a very influential part of their life and their care. They trust you. They develop a relationship with you. They do things for you that they won't do for other people. Your input is very important for their care plan, even though you don't have to write their care plan. If you notice that their plan of care is changing or how you take care of their daily living activities, you need to let us know so we can update their care plan. And then your time management skills are very important. It's important for you to learn. This is the hardest thing for you to learn as a new CNA, is to get everything done in a good amount of time. You can't be rushed. You can't have everything on your schedule. It goes by the resident's preferences. So even though you come in for the day and make a plan and want everything to happen this way, don't get upset if it doesn't happen the way you have it planned. We have to give the residents options. If they want to take a shower before breakfast, then we can give them a shower before breakfast and have to work it into your schedule. But you have to make sure you're ensuring meeting the needs of the residents when you are planning your day. Now, if somebody has, we talked about a transport, if they need to go to the hospital, they have an appointment, the nurse will let you know they have an appointment that day. It's your responsibility to make sure they are up and ready in time for the transport team to get them. They have to have their legs on their wheelchair. They have to be dressed. They have to be groomed. They have to be changed. They have to be dry. Make sure they're up and ready to go so they get to their appointment on time. Same thing for an activity. If they ask you to take them to an activity, make sure you help them get up in an appropriate amount of time to get ready to get to that activity, so they're not late getting to their activities. But prioritizing your resident care is important. At the beginning of your shift, you're going to make rounds. Some places have you make walking rounds with other team members, the other CNA that's leaving for the day. You're going to walk around with them and lay eyes on every resident, make sure everything is all right, and then give each other a report about the changes that happened during your shift or any upcoming information that you know about the resident. So there are 3 different shifts in long-term care. Normally you work 8-hour shifts, and they are overlapping shifts. Even though they're different, there's still an amount of time where you are both there in order to get report, to give information to each other. And that overlapping shift may be 5 minutes before, 7 minutes before, 5 minutes after your shift, 7 minutes after your shift, but they are overlapping. Most places are going to work these 8-hour shifts. Nursing care is 24 hours a day, 7 days a week, 365 days a year. You have to work holidays, you have to work weekends, you have to work on whatever time frame. Some places you work 3 days on, 2 days off, 2 days on, 3 days off. Some places let you go every other weekend. It just depends on where you work, and during your interview you need to ask them what their expectation for your shifts will be. People work full-time, people work part-time, people work PRN, where they only come in and work 1 day a week. All of your benefits and things need to be discussed during your interview for your hiring interview. Your AM care and PM care is everyone's responsibility. If it doesn't get done on your shift, pass it along to the next shift and it can get done on their shift. So just make sure that you know that this is a continuum of care, that it's not just it was supposed to be done on days, so it's going to wait till days tomorrow to have it done. If you have a complaint about another CNA, tell that CNA directly. We talked about that in the communication chapter, about not being passive, but not being aggressive, but having compromise. Okay. So this next video is just a little bit about AM care. Just like when you're taking care of yourself and you wake up in the morning, you want to wake up, brush your teeth, brush your hair, maybe have a shower. Everybody has their own differences and their preferences.
It is important that you help residents to prepare for his or her day by performing AM care each morning. This will include helping the resident get out of bed, assisting him or her with toileting and personal care, and getting him or her ready for breakfast or other activity. As always, perform your beginning procedure actions. If appropriate, assist the resident to get out of bed. The resident should have a gait belt in place. Assist the resident with toileting as needed. Assist the resident with washing hands and face as needed. Assist the resident with other needed personal care, such as oral care, perineal care, dentures, eyeglasses, and dressing. Then assist the resident into a safe and comfortable position for breakfast or other activity as appropriate. As with any procedure, finish by performing your procedure completion actions.
So residents are allowed to choose what time they want to wake up. Some of them get up at 4 a.m., 5 a.m., some of them want to sleep until 7 or 8. So as you work somewhere, you will get to know their routines and their preferences and be able to prioritize your time around what their preferences are. Okay. The day shift usually starts either 6 a.m. or 7 a.m. There's differences now. Some places in town are starting at 6. They work 6 to 2 or 7 to 3. You get a 30-minute lunch and 2 15-minute breaks, but you are there. You have to be on time. You need to clock in a few minutes before your shift so that you can give report. It usually is the busiest shift of the day of the 3 shifts because there's a lot going on during the day. You have 2 meals to feed. You have doctor's appointments during the day shift. You have new equipment that comes in that gets implemented. You have doctors coming in, writing orders. You have nurses in there doing treatments. So sometimes it usually is a very busy shift. You have to be able to have good time management skills. You're going to help them with breakfast. You're going to help them with snacks twice. You're going to help them with lunch. They're going to have labs. They're going to have x-rays, all of these things going on, lots of recreational activities, lots of meetings and care plans and staff meetings that you may have to attend. So all of these things go on every shift, but the majority of the time there are more people there on day shift or AM care. AM care is going to include bathing, brushing teeth, removing the germs so that people don't get infected. If someone refuses AM care, it's fine. You need to write it on the chart that you offered and they refused. That way it doesn't look like it was just neglected and it wasn't done. Make sure people are brushing their hair before they come out in public. Make sure they're putting on decent clothes, not walking around in their pajamas. They are in their home, but it is a facility and there are other people around. And even though they're older, they still care about their appearances. Dignity issues. The evening shift is going to start then, either 2 p.m. or 3 p.m. and go until 10 p.m. or 11 p.m. Same thing with a 30-minute lunch, 2 15-minute breaks. It's usually a little bit of a quieter shift, but you still have to feed dinner, and you still have to get people down and ready for bed to go to sleep. We talked about sundowners in another chapter. When in those early evening hours, people start getting a little bit more confused. So usually after that evening meal, we may want to get them, some people want to take a shower in the evening before they go to bed. But this PM care is the care that's given before bedtime. They need to get undressed from the clothes that they're in for the day. They need to get into pajamas or a gown or something to wear to sleep. They get a partial bath and clean off the private parts or clean off the underarms, wash their face, get some oral hygiene. They need to be toileted again before they go to sleep. And we're also going to do back rubs as part of PM care, just to make sure there's nothing stuck to their back, make sure that they're comfortable. It improves circulation. We're going to learn about that in another chapter. Here it is again about the sundowners, periods of your extreme agitation and confusion during the late afternoon or early evening hours. They may not want to go to sleep. They may just be wandering around. They may be combative. They may start saying hallucinations. Let the nurse know if you're having problems and we can help you get them off to sleep.
As always, start each new procedure by performing your beginning procedure actions. Assist the resident with toileting as needed. Assist the resident with washing hands and face. Assist the resident with other personal care, such as oral care, perineal care, and dentures. Store eyeglasses, hearing aids, and dentures as appropriate. Give the resident a back rub. Assist the resident into a safe and comfortable position for sleep or other activity as appropriate. Finally, perform your procedure completion actions.
And the night shift is going to be from 10 or 11 p.m. until the next morning at 6 a.m. or 7 a.m. when the day shift comes back on. Night shift is usually a quieter shift, but it doesn't mean that there's nothing to do. Some residents don't sleep at night. Some of them still need to get up in the middle of the night and go to the restroom. Some residents want to get up at 4 or 5 in the morning before your shift is over and get up and get in the shower before day shift comes on. They like to get up and have a coffee. They like to get up and start reading the paper. So there are still things to do on night shift. There is the least number of staff on duty, but you still have a nurse. You may not have the nurse manager there or the management team there, but sometimes they do come in on night shift as well. But you still have a nurse that you can, a staff nurse or a floor nurse that you can report things to. You're going to complete tasks that the previous shifts weren't able to complete. You're also going to help restock and fix the paperwork and fix the charting for the next day. You're going to clean the wheelchairs. You're going to charge the lift batteries. There's always a list of extra chores that need to be done on each shift. And the night shift usually has more chores of restocking and getting everything ready for the day shift, for the next. But you're going to use those same supplies on your shift too. And every shift, if you use the last of something, replace it. If you're running out of something, let the nurse know before you're completely out of it. Starting the residents up in the morning, getting them dressed like we talked about, dealing with unexpected problems and emergencies. There are a lot of falls on night shift. People are trying to get up, get to the bathroom, the call light is on, they lost their call light, they can't find it, it's dark, they trip over something, they're on the floor. Even though you're on night shift, every 2 hours, you still have to round on your patients, make sure they're still in their bed, make sure they're still breathing, and make sure they're still in the building. You don't have to wake them up and talk to them, but you can tell if somebody is still there. So even though they're in their rooms, the door is closed, the lights are out, still go in and check on them every 2 hours to know where they are. And then maybe they need to wake up and go to the restroom. Help them to the restroom. As far as an unconscious person, we still are going to turn the lights out in the evening hours and at nighttime. Even if they're unconscious, they still have to have a day and night cycle for their body to heal and for them to get good rest. So make sure you turn the lights out. The lights aren't turned on 24/7 in their room. At night, the lights are out, the sounds are low, the smells are gone, and people can rest. We're going to talk about that in the Vital Sign chapter, about good rest and good sleep. So every shift has to consider the resident's needs over your own needs. So if a resident refuses, you need to go on with something else, plan your day again, and come back to them at a different time. The shifts are just a framework for care, but it doesn't have to get done at a certain time. Each shift has specific duties that we would like to get done that don't involve the residents. You can go do some of those duties while you're waiting on the resident to decide when they want to have something done. Okay. Managing your time is very important. You need to be balancing the art and science of nursing. You need to do things safely. You need to do things efficiently. You need to wait and get care, have someone else come and help you, but you also need to make sure you're using your time wisely. So, residents' preferences and routines. You need to encourage their independence. They can do things for themselves. They need to do things for themselves. You're not their slave waiting on them hand and foot. If they can do it for themselves, it's best for them to do it for themselves so they don't lose their independence. Let them do as much as they can and encourage them to do as much as they can for themselves. Your shift responsibilities are feeding, meal times, intake and output, bathing, weights, vital signs. If you get a new admission, you're the first person in that door to meet and greet that person as soon as they arrive. The nurses are not going to micromanage you and tell you, oh, they're here. You should know they came in the door. So it's your job to keep a lookout. If you know you're getting a new admission, keep checking back on that room and see if the admission is there yet. Okay, it's communication between the team members, but you're the one that's going to meet and greet and orient these new admissions to the floor. Your assignment, your daily routines, it is assigned to you on an assignment sheet that you get from the charge nurse. If you have an issue with a resident, you can ask another CNA to swap with you, but you need to make sure that the charge nurse knows that you've swapped residents. Sometimes we know that some of the female residents don't want a male attendant, and then we will change that on the assignment sheet. But the assignment sheet needs to be accurate with who we know is taking care of each resident. Make your rounds first, prioritize your duties, make sure you know which tasks are important. If someone has an appointment, that's an important task. If someone's going for a test, they need to be on your top priority list to get ready, get up, and get there before they miss their appointment. Any special needs, any special tasks, any special admissions, transfers, all of that is your responsibility to keep up with. Okay. Delegation of duties. You're never supposed to do anything that you're not trained to do. If you don't know how to do anything, you need to ask. So sometimes another CNA may not give you the correct information on how to do something. So if you really need something specific to that person's plan of care, make sure you're asking the nurse and not another CNA. But you are going to ask other CNAs to help you if you need help transferring or if you need help watching someone or ambulating someone down the hallway. Okay. You're never giving medications, and you're going to leave the very sick and the very ill patients up to the nurse. The nurse is going to be able to take care of them, give them their medicines, give them their treatments, be with them, the sick person. You can go and take care of the other residents that you can do something for. You can help ambulate, you can help get showers, you can help do all of their ADLs, and you can definitely help with new admissions. So if it's a very sick person, it's usually the nurse is going to be in that room while you are doing other duties that need to be done. Another example of your assignment sheet again, it just has a list of the patients. It has when their baths are due, Monday, Wednesday, Friday, Tuesday, Thursday, Saturday. They don't get baths every day. We're going to talk about that in the personal care chapters. But if they want a bath, they can have a bath on any day. You can't say, oh, today's Tuesday, your bath's on Wednesday, wait till tomorrow. You know, people get baths, PRN. You change their sheets, PRN. Anytime anything needs to be done, just be proactive in going ahead and get it done. And work together as a team.